Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today I'm joined with Beth Erhardt. She's an occupational therapist and a specialist in dealing with lymphedema. Hi Beth, it's great to have you here.
Hi, thank you. Thanks for asking me.
To start off, let's talk a little bit about prevention. For a patient who's had breast cancer, are there things that she can do to prevent or reduce her chances of getting lymphedema after cancer treatment?
Right, but we don't really say prevent.
Okay.
We usually say we're reducing the risk.
Okay.
We know that women that have had, or men that have had axillary node dissections of any kind are at a risk for it. So we have general precautions that we give our folks. The first, maybe the most important, would be to avoid infection. So we don't want people to get a cut, scratch, burn, insect bite where bacteria can enter. That may increase their risk for infection. So we suggest wearing a glove when they're working outside, keeping the skin moist, avoiding blood work done in the arm, avoiding injections. Another general point would be to avoid constriction. You don't want anything to really hug the at-risk limb tight. No tight jewelry, no tight clothes. You don't even want to have a blood pressure cuff done on that arm, if you can avoid it. We also want to avoid extreme temperatures. So if you're in the sun for a long period of time, you may get a sunburn, but you also may increase the blood flow, which may increase your risk of lymphedema. Or if you have heat, like sauna, or maybe in a hot tub for over 15 minutes, you may be increasing your risk. The same with cold. If you're outside in the cold, extreme cold for a while and you're not covered, you may have a rebound effect where you get some swelling afterwards. You want to consider compression. It's a little controversial, but people that are traveling by air might benefit from a compression sleeve. If you're doing strenuous exercise, you may benefit. It's really the individual's choice. But know that if you decide to do it, you should be measured by a fitter who's going to measure your arm and include a hand part so that you don't have swelling in the hand and not the arm. I think it's important to realize that there's not a lot of strong literature that will say, or strong research that will say, this is the bottom line, you have to do these precautions. The fact is, we know what impairs the lymphatic system, we know what damages it, and that's why the general guidelines have been made. But the bottom line is, we want patients at risk to use the extremity. We want them to do things. We want them to exercise. Certainly it's a healthy choice in life, helps you to maintain your weight, which is good for lymphedema, and it conditions the arm so you're at less risk for injury for the arm.
Are there certain symptoms that a patient with lymphedema may experience?
I think a common complaint is the arm becomes heavy, they've an achy, kind of tired, and they don't see swelling, and they're not sure what to do. And that may be a symptom, and I would tell my folks, back off, don't do as much, go back later and work a little bit, but don't do quite as much of a strenuous activity. But also people may experience some tightness in their clothes, or maybe if they're starting to get it in their hand, they may develop some tightness in their hand. Maybe they wouldn't have the same flexibility.
What about swelling in the arm or the armpit? Do you see that a lot in your practice?
Right, well that would be a symptom. The swelling is the first symptom,
Yeah.
I mean if they have it, but before they see swelling, they may have other sensations that may indicate that they could be getting swelling and to back off, and that's what I was sort of focusing on.
Okay. If you've been identified as having lymphedema, are there things that you can do to prevent or reduce your chances of having a swell-up?
If you think you have lymphedema, you probably should see a professional. You want to get treatment. We know you'll do better if you intercede early and have that taken care of. And there's various treatments that are out there. The gold standard would be a decongestive therapy.
Are you able to tell me a little bit more about compressive therapies?
Sure. That comes in, that's actually two phases. The first phase, a lot of it will, the length of time depends on how long the patient, or how long the patient may have had swelling, or how large the limb is. But there's two phases. The first is where the patient comes in and receives remedial exercise, a lymphedema exercise. They get a lot of education on skin care, and their skin is protected. They receive manual lymph drainage, which is a I don't want to say massage, but they're light techniques to help to move the fluid to a part of the body that can absorb it. And there's compression therapy, where it usually may involve compression bandaging and or a garment that they would wear. That's phase one. Phase two is go home and manage with a similar type of program.
And if a patient does have lymphedema, what's safe to do and what's safe that they should they not do?
If a patient has lymphedema, when you're talking about safety, they should continue to follow those at-risk precautions. But when you think about lifestyle choices, we still want them to exercise. We want them to use their arms too. And people that have gone through treatment will know that. But they'd be familiar with their flexibility exercises, maybe that they did after surgery. They'd be familiar with their remedial or lymphedema exercises. They can still do aerobic exercises, things like biking or swimming would be fine. They do want to monitor their arm. They can do resistive exercises, weight training, those kind of things. But that's something that's done gradually. They're monitoring their arm. They are wearing their garments. They're starting off with maybe just a few repetitions, low weights, and gradually building up. And if they need help, they could see a professional to help them, somebody that is familiar with lymphedema and trained in lymphedema.
If a patient wants to get more information about lymphedema, can you provide some suggestions of places or resources where they may want to go?
Online site, the National Lymphedema Network. It's www.lymphnet.org. It's a great resource.
Beth, this has been really great. Thank you so much for giving us helpful tips about how to prevent and treat lymphedema. I hope this was helpful. Thank you so much for joining us.